Welcome back to the Colorectal Surgeon. I am Dr. Samrat Zankar. Today, once again, we are back with another topic on piles. November month is a piles awareness month. We celebrate across India, across the world. Piles is one of the important topic we need to understand because it's a very common, almost 3 to 4 out of 10 people are suffering with piles. And when piles is there, people will take haphazard decision. So today's topic is about biofeedback in piles. Is there any evidence and how it helps? We know that for piles, for prevention, you need to avoid the constipation. For treatment, you need to recover from constipation. For avoiding recurrence, you need to avoid again constipation so that the piles will not recur. So in constipation, particularly if you are straining and your pelvic floor is not relaxing, that leads to a strain related, constipation related piles problem it will come. So for that purpose, if you are learning how to avoid straining, that's mainly in case of dyssynergic defecation. A dyssynergic defecation is a pattern where person will contract but pelvic floor doesn't relax. Because of that, person will put lot of pressure and unrelaxed pelvic floor, not opening anal opening. You need to put lot of pressure, lot of straining. Because of that, the tendency of vein getting swollen and leading to development of the piles is common. If you are having this kind of dyssynergic defecation diagnosed based on manometry and clinical history, in those patients, training the pelvic floor how to relax is most important to prevent the piles further to come, or in short, avoid the piles to develop. Even in early stage, grade 1, grade 2, if you train the pelvic floor how to relax, it will reduce the chance of becoming larger complicated piles. So this training is typically known as biofeedback therapy. Biofeedback is nothing but training your brain how to defecate without straining. That's what the biofeedback therapy. So biofeedback particularly has lot of evidence in chronic constipation treatment, particularly dyssynergic defecation. Although there is less evidence, less talked about training the pelvic floor for hemorrhoid patient, but friends, the training is more important to prevent. In biofeedback, they will be trained based on anal manometry, catheter based or EMG based biofeedback therapies are there. Based on that, the therapist will train how to relax the pelvic floor and how to coordinate the rectum and pelvic floor so that rectum will push, pelvic floor will open and you will evacuate without straining. And your straining reduces the chances of piles development will reduce, or increasing stage of the piles also can be reduced. So that's what the role of biofeedback in case of piles. If you diagnose with piles and you are having symptom that you need to strain lot or you need to put lot of pressure, you feel that incomplete evacuation, something is left inside the rectum, you feel that something is blocking in the anal area which is not allowing to evacuate properly, you need to spend lot of time in the toilet to coordinate and evacuate. In those patients, biofeedback definitely will help for treating that type of constipation. Per se, the constipation reduces, coordinated action happens, you evacuate within short period of time, chances of developing piles will also reduce and complication of piles will also reduce and you will get the benefit. So friends, if you are having constipation along with piles, particularly dyssynergic defecation, another one modality of treatment is available, that is biofeedback therapy, which helps to treat the constipation. By default, it treats the early stage piles to cure, and if you are not having, avoid to prevent. If you have had treatment, still you are constipating, avoid to recur. So friends, in piles, biofeedback is one of the added modality of treatment which is non-surgical, non-invasive, but definitely cure the root cause and prevent and treat your piles. I hope biofeedback role in piles treatment, particularly associated dyssynergic defecation, you understood. If you feel you got good information from this video, like our video, share our video and subscribe our channel. Don't forget to see tomorrow video on piles, another topic to understand about the piles. Thank you. Thanks a lot.